Dr. Ray Clifton is a senior primary care physician and practice manager of a clinic in California. He has 20-plus years of experience and treats twice as much the local patient population as he is a more experienced physician. Such busy practices often faced challenges that forced him to rethink his decision of managing their RCM process. Dr. Ray Clifton faced challenges such as being understaffed, inexperienced staff, and too much workload in the front office, etc. Increase headcount at his practice and recruit a huge medical billing and revenue management team to curb the loss of revenue and increase collections. Luckily, Ray Clifton made a choice that would tilt the scales in his favor. A choice that helped him to get rid of bottlenecks and stay profitable. He chose to call BillingParadise. BillingParadise handles dozens of desperate calls a day from physicians who cannot understand, or have no inclination to understand, the business side of medicine. This is the first question we asked Ray Clifton when he called our billing support manager for analyzing his revenue management cycle. After getting a detailed breakdown of our services and inquiring with some of our existing clients, Dr. Ray Clifton opted to work with us. It's been 3 months since he made that first phone call, and Dr. Clifton has been tremendously impressed with the 24/7 medical billing support of BillingParadise. I'm amazed at the results. I can finally go to work without worrying myself sick about high bills and unpaid claims. For our RCM services, he benefited from positive results such as 5 to 7% increase in net collections, 99% first pass claim acceptance rate, 85% reduction in denied claims, 3 times quicker workflow.